Hello, I'm Dr. LeTa Jussila. I am a doctor of acupuncture and oriental medicine, and here today as part of the medical advisory board for Prime My Body to share with you in this mini video series some things that you can do to improve your overall mental well-being. First, I'd like to make sure we're talking about the same thing, so it's always a good idea to create some definitions. How do we define mental health? It's important to know what healthy looks like so we can assess how we are doing. So mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, how we make decisions, how we realize and understand our own abilities, how we learn well, how we work well and build relationships, and also shape the world we live in. Mental health is absolutely a basic human right, and it is more than the absence of a mental disorder. It exists on this complex continuum, which is experienced very differently from one person to the next. Now, the term mental illness is a label that can suggest that someone might be crazy, deranged, disturbed, unbalanced, unhinged, or unstable. I mean, even though these adjectives actually apply to an extremely small percentage of people, getting a mental illness diagnosis can fill people with shame, and there's a stigma to anybody who experiences these issues associated with the mind that makes us less likely to talk about it or seek help. What's worse, mental illness is viewed as a character flaw, like as if someone's choosing to be unhappy, anxious, or moody. It's time to change the discussion around mental health and how we name how we are feeling. Now, I find it important to remain empowered, even though I may not know exactly what to do to feel better. It certainly doesn't help if me, or of course someone else, labels me with a mental illness. Part of the problem has been with the field of psychiatry, because the emphasis on the mind and the psyche as the root cause, well, when we look at brain imaging, it teaches us that mental health is really brain health. So our reframe for anybody wanting to improve their mental health is to actually focus on brain health. Now, why is it such a huge conversation right now? Well, first, more of us are more willing to openly discuss our own personal mental health concerns. We are being exposed to more people because of social media. And this social proof allows more people to feel safer to express what they're going through, when in the past, one would go to at lengths to hide it. But the more important question is why? Well, certainly the pandemic did not help. I mean, many of us were stressed from potentially losing or have lost family members, physically distancing for months, schooling online, cancellation of graduations and sports competitions, time with relatives and friends were lost, actually lost to basic services like mental health care, social services, even housing. I mean, this has all certainly taken its toll. And we're really now seeing the true intersection of mental health and COVID-19 as a pandemic of psychological problems, such as anxiety, depression, PTSD, addiction. Mental health is an essential part in overall health, and many people have brief periods of mental health issues and then completely recover, and others suffer most of their lives. Now, regardless of the cause or the duration of mental distress, it is important for each of us to be able to recognize, manage, and learn from difficult emotions that we feel. And instead of coping, we need to seek out strategies that are solutions. I often suggest to patients that our job is to tune in, not tune out. And I also remind folks that when you are having an imbalance in one part of your health, most likely it's affecting other parts as well. Now, there are constant physiological processes that are continually taking place in our bodies. And any disturbance to this homeostatic balance can result in, unfortunately, severe consequences. There can absolutely be a chemical imbalance. If you have long-term emotional imbalances, certain behaviors can affect someone's mental health. I'm going to be sharing with you some practical research-backed suggestions that you can do for yourself, or perhaps suggest them for those you care about, only when you are able to compassionately be present and trust that giving suggestions is a good idea to that person that you care about in that moment in time.